हेलो एवरीवन, वेलकम बैक टू अनदर क्लास। और लास्ट क्लास में हमने कुछ दो क्लासेस आई थिंक हुई है, उसमें हमने बोन्स के बारे में सब कुछ डिस्कस कर लिया था। टुडे वी शैल बी डिस्कसिंग कार्टिलेज। विल डिस्कस एवरीथिंग फ्रॉम द बेसिक्स टू द एडवांस, ओके। एंड आई नो दे आस्क examples of various examples of this cartilage in your various exams, especially in your university exams. So we shall be discussing that as well. We will be revising that in 3D model as well. So we will revise all those examples first in theory, then in 3D model, so that you will remember it for a longer period of time, right? And by the end of this class, you shall be able to answer these questions. Questions like which cartilage lacks perichondrium, right? Basics, okay. What is yellow cartilage? In which type of cartilage ossification occurs only with bone repair? Ossification occurs but only with bone repair. So let's see if you are able to answer these questions by the end of this class or not. If you already can answer it, good to go. You will learn a lot more than this in this class. But if you can't answer this by the end of this class, I'm sure you will be able to answer this, okay. So हम आगे बढ़ते हैं, चलो. So first we shall discuss what is cartilage, right? So let's see what literature has to say first, then we'll go ahead, okay. So first, literature. So cartilage is a connective tissue, okay fine, composed of cell and fibers. These are embedded in firm gel-like matrix that is rich in mucopolysaccharides, okay fine. This is just bookish language. Just go through this once and then we'll understand the concept. It is much more elastic than bone. Obviously we know this, it is much more elastic than bone, right? And cartilage does not have blood vessels. I already told you about this in our last class as well. Cartilage does not have blood vessels, it does not have lymphatics, neither it is having a rich nerve supply, no nerve supply, so it is insensitive to pain as well, right? So no blood vessels, lymphatics. Chondrocytes get their nutrition. So yeah, basically you may ask this question ki sir, if it is not having any blood vessels, if it is not having any lymphatics, then how is it getting nourished? So yes, chondrocytes get their nutrition from by diffusion, okay. So by the method of diffusion they are getting their nutrition, not by direct supply through blood vessels. So they do not have blood supply as such. And cartilage has no nerves and is insensitive, I already told you. So this is a basic information about cartilage, you know. Cartilage is very important in our body, okay. It plays a lot of important roles. We shall see that in the upcoming slides. But yes, this is the basic info that your core literature says, okay. So let's go ahead now. The basic answer will be a basic question. Next will come, is this only, that what does cartilage do in our body? So yes, first it is the main, the main function of cartilage, which is absorbing shock, okay. So cartilage cushions your bones and joints when you move and use them. Obviously it absorbs force and reduces your how much stress and impact puts on your bones. So this is very important. Obviously, naturally, when we walk, when we do certain movements, there are pressure being generated. Pressure के साथ क्या होता है? There are wear and tear which can happen. But who protects us from this wear and tear? Cartilage plays one of that role, जो shock absorber की तरह काम करता है. Now don't worry, we will do this example कि भाई अगर हम joints की बात कर रहे हैं तो there will be articular cartilage. We'll talk about it. वो कौन सा कार्टिलेज होता है ना, वी विल टॉक अबाउट वेरियस काइंड्स ऑफ कार्टिलेज टुडे ओनली. कि हाइलिन कार्टिलेज होता है, देयर इज फाइब्रो कार्टिलेज, देयर इज इलास्टिक कार्टिलेज, हाउ कैन वी डिफरेंशिएट बिटवीन देम एंड व्हाट आर द एग्जांपल्स ऑफ देम, राइट. सो कौन सा कार्टिलेज कहाँ पे होता है, डोंट वरी अबाउट दिस नाउ, वी विल डिस्कस इट इन द एग्जांपल्स, ओके. फॉर नाउ अंडरस्टैंड कि यस, कार्टिलेज हेल्प्स इन एब्जॉर्बिंग शॉक एज वेल, okay. So think about the difference between jumping up and down barefoot and wearing running shoes, okay. Yeah, this is a very nice example that they have given, okay. So consider it like this कि आपका जो आपके शूज़ हैं, they are like your joints, okay. You walk on them, you do movement with them. But शूज़ के अंदर जो आपका सोल लगा होता है, राइट, जो रबरी कुशनी सोल लगा होता है, that is of much importance, right. It helps in absorbing shock and everything. So that sole, you can compare it with the role of cartilage, okay. So cartilage is comparable to the role of that sole of the shoes. So this is how they have given it, and this is very nice example. So acts like a cushion in your sneakers on the inside of your joints and around your bones. So this is of very important point, okay. So okay, go ahead. Then second, the example of the second this function of cartilage is to reduce friction. Of course, everybody knows this. It reduces friction. How, sir? Okay, cartilage lubricates your joints. It helps your bones slide past each other without rubbing together. This lets your joints work as smoothly as they should and reduces wear and tear on them. So just need to know this main headlines. Okay, yeah, cartilage helps in absorbing shock. Yes, cartilage helps in reducing friction, and we'll go in details as we'll move ahead. Okay, so reducing friction, absorbing shock, then what? It supports your structure. Of course, it supports your structure. Your nose, your ear pinna. See, look at their shape is maintained because of the cartilage inside them. Okay, so yes, it does support your structures in your body. Cartilage helps your joints also keep their and joints keep there in shape while moving. It also connects other tissues together and to your bones, muscles, tendons, ligaments. All are connected to cartilage throughout your body, and this is how it supports them. It supports their shape also. It helps in maintaining their shape. Okay, so joints को भी जब वो move कर रहे होते हैं, especially see when they are mobile, they are vulnerable, right? So in that moment, it helps in maintaining the shape of the joints, so that wear and tear ना हो या dislocation ना हो या whatever. It supports them, है ना? It gives them support. So this is of a much importance. ठीक है, तो ये तीन basic core हमने what to say the फंक्शंस ऑफ कार्टिलेज हमने पढ़ लिए. अब हम आगे चलते, थोड़ा और डिटेल में चलते. ओके, ये बेसिक हो गया. जिसको बिल्कुल नहीं आता था यहाँ से शुरू करो, बाकी जिसको आता है चलो आगे बढ़ते हैं. सो ओके, कॉमन कंडीशंस दैट affects cartilage. Now this is very important, right? कि हमको पहले ये भी तो समझ में आए that if we are studying about cartilage, what is the clinical correlation of the cartilage? Okay sir, we accept कि cartilage helps in absorbing shock, cartilage helps in reducing friction, cartilage helps in maintaining shape. But are there any conditions which may occur if there is defect or damage in this cartilage? Definitely yes. So first, most common conditions I am discussing right now. Okay, so first condition is your let me mark it down. So first is, most common is injury. Any injury can occur, especially in sports, right? So injuries or other trauma can damage or tear cartilage, right? Some of the most common sports injuries, like to meniscus or a separated shoulder, can damage the cartilage in your joints. Injuring a joint can cause osteochondritis dissecans. Okay, so this condition you must know कि whenever you injure a joint, है ना, this condition can arise, which is osteochondritis dissecans. It is also known as osteochondral lesions, है ना. So chondral means cartilage only, so you know this. So osteochondral lesions or osteochondritis dissecans, this may occur if you injure a joint during any sports or whatever. In any movement also it can occur. Okay, next condition is your osteoarthritis. Okay, so osteoarthritis is very common. Osteoarthritis is the most common type of arthritis. See, this is so important, right? Here only we are doing what? Here only we are clinically correlating also कि हम cartilage पढ़ क्यों रहे हैं भाई? Cartilage इसलिए पढ़ रहे हैं क्योंकि इनकी conditions important है. So osteoarthritis is the most common type of arthritis. In fact, okay, see ahead. In fact, 80% of adults older than 55 have some amount of it in their joints. Okay, as you age, the cartilage in your joints can break down. Eventually this can lead to pain and inflammation in your joint because there is not much cushioning and lubrication as there used to be. So see, we already studied कि हाँ, cartilage helps in cushioning, cartilage helps in lubrication. As you grow old, you are using your joint so much of time that cartilage may get damaged. There is not cushioning, there is not lubrication. Joints will get damaged, it will get inflamed, that will pain, and that is known as osteoarthritis. Okay, so osteoarthritis is the most common type of arthritis. And cartilage का defect या damage होना एक role play करता है उसमें. Okay, let's go ahead. Another one is another condition, very important condition out of three I have brought, because these three are the most common that you will see in day-to-day life. So another is herniated disc. Now you all must have heard about it. Okay, so herniated disc, also sometimes referred to as slipped, ruptured or bulging disc, happen when disc of the cartilage between your vertebrae is torn or punctured. So between your vertebrae, right, in your vertebral column there is intervertebral disc, that is nothing but cartilage. Which kind of cartilage? We'll talk about it, don't worry. By the end of this class you will be good to go with everything. Okay, but yes, there is cartilage, and that may get damaged, and that can lead to herniated disc. Okay, it is quite common, you will see it especially in older people or who lifts heavy weight, है ना, तो in those kind of accidents this may happen. Okay, so we have already studied what we have studied. What is cartilage? We have the very basics of it. We have studied what is the function of it. We have already studied what conditions can occur when there is defect or damage to those cartilage. Now we'll go into more advanced knowledge ki what kind of cartilages are there, how will we differentiate them, what are the examples of it. And don't worry, I will make a summary of it at the end of this class. In that one chart we'll discuss every single thing. So after understanding everything, once you do that chart, this chapter is done for you. Okay, let's go ahead. Okay, so see, there are three types of cartilage. First is your hyaline cartilage. Now this is very important, guys, very important for you to understand how do you differentiate hyaline cartilage, because see, this histological pictures is what they give you in exam, and they ask you to identify what is this kind of cartilage, what is that kind of cartilage. And trust me, if you don't know the basics of it, you may get confused in that high pressure cooker situation in the exam. So not only I will give you I will show you just one picture, we will do multiple pictures or multiple photos of all three cartilages, so that you understand ki, okay, there are basic differences in various pictures, but still we can if we know the basics, we are able to get to the core of it, gist of it, ki which one is which cartilage. Okay, so let's see how we can differentiate it. So see, first hyaline cartilage and what literature has to say, let's see that, then I will tell you what are other important points of it. Okay, so let's read it out. Hyaline cartilage is the most common type of cartilage. Here only oneself, very important information. It is the most common, and I will write it out whatever is most important. Okay, so most common type of cartilage. Okay, understood. So hyaline cartilage is the most common type of cartilage. Next, it lines your joints and keeps the ends of your bones. Keeps the ends of your bones. That's what I was talking about. Now, here a confusion can arise. Okay, when you talk about a knee joint, okay, let's say knee joint. In any joint per se, you have bones to bones coming together with each other. So that part of bone, okay, that is line which is forming this articulation, means joints जो बना रहे हैं, वो surface of bone will be covered with this cartilage, which is known as articular cartilage. Articular cartilage is nothing but hyaline cartilage. For now, you should understand this. I'll talk about menisci again, and I will explain knee joint again, and then the confusion which arises, I will talk about it. But for now, trust me, go with me, that any surface of the bone which is coming in, which is forming articulation with another bone, that means joints, है ना, तो वो surface जो cover हो रही है, that is articular cartilage. Articular cartilage is nothing but hyaline cartilage. For now, you should understand this. Okay, चलो आगे बढ़ते हैं. So yes, hyaline cartilage at the end of your bones is sometimes referred to as articular cartilage. So they have already given it here. I was not knowing that. So hyaline cartilage is slippery and smooth. That's why I think they are forming that joint surface. They are covering the joint surface because that is required here. So slippery and smooth, which helps your bones move smoothly past each other, over each other in your joints, and it's flexible but strong enough to help your joints and hold their shape. So what is the gist of hyaline cartilage? अभी और मैं पढ़ा रहा हूँ, but अभी इस literature से हमको क्या समझ में आया? It is the most common type where it is covering the surface of bones, है ना, at the end of bones where they will be articulating with another bone, है ना, in joints, forming the joint. That cartilage will be known as articular cartilage. Articular cartilage is nothing but hyaline cartilage, है ना. So this is how we have understood it. Now let's talk about this, है ना, the elephant in the room. That how do you, let me write it down, how do you differentiate or identify in the histological picture? Okay, this is very important कि हमको सर ये तो हमको पहले भी आता था कि हाइलिन कार्टिलेज क्या करता है, मे बी हमको नाम नहीं पता था, मे बी इतना बेसिक नहीं पता था, मे बी पता था, पर आप ये बताओ कि हम कैसे आइडेंटिफाई करेंगे, क्योंकि एग्जाम में तो वो पिक्चर्स देंगे. ओके, सो लेट अस डिस्कस दोज थिंग्स. ओके, आई गिव यू द इंपॉर्टेंट पॉइंट्स. मैं आपको वो इंपॉर्टेंट पॉइंट्स बताऊंगा, क्लिंचर्स जो आपको ध्यान में रखना है, रेस्ट एवरीथिंग इज नॉट इंपॉर्टेंट. ओके, सो लेट्स गो विद दैट. ओके, when it comes to hyaline cartilage है ना, बुक की थोड़ी सी लैंग्वेज, हैज एन amorphous, this you will understand I think, glassy appearance. Okay, it has glassy appearance, amorphous appearance. so glassy होगा, homogeneous होगा, है ना. ऐसा नहीं लगेगा कि बहुत सारी चीज़ें आपको उसमें दिख रही है. it will look homogeneous, not heterogeneous. so this is very important. I'll show you various pictures. By the end of this class you will understand. So right now go with me. So has an amorphous glassy appearance. Okay, and is made up of abundant, which kind of collagen? Type 2 collagen. Okay, we already did this in the chart in the previous classes. Okay, so you can look at those. Okay, now abundant type 2 collagen fibrils. Now where can it be found? Now we will do examples in that in a very detailed way in the chart, but still some of the examples you should have it on the tip of your hand. So let's see examples where hyaline cartilage is there are very important. Your nasal septum, epiglottis, your ribs, your larynx, and your trachea. All of this places hyaline cartilage can be there. Okay, understood? सबको समझ में आ गया. So आपको अभी ये याद रखना है कि ग्लासी अपीयरेंस होता है जब हम तीनों को डिफ्रेंशिएट करेंगे. when we will compare all three cartilage, more differentiating features will come up. Okay, so that time we'll discuss them, but for now you should understand that there is homogeneous picture. Okay, so other than this chondrocyte, what you see here are so many chondrocytes. Okay, so these are chondrocytes that you are seeing, but other than that what you are seeing other than chondrocyte is nothing. It looks like homogeneous. It is completely looking like similar picture. There is nothing else you are seeing overall कि भाई chondrocytes के अलावा भी बहुत सारा कोई material दिख रहा है क्या? No, it looks homogeneous. So that's what they mean by glassy appearance, homogeneous appearance. Okay, when you will see. Okay, for example, see here, ये आप देखो इलास्टिक कार्टिलेज में यू आर सीइंग दिस अगेन कॉन्ड्रोसाइट्स, है ना, मच मोर बिगर यू आर सीइंग और मच मोर इन नंबर आई शुड से. बट व्हाट यू आर सीइंग अदर देन दिस इज दिस elastic fibers you are seeing. See, so many fibers are there, है ना, highly dense purplish fibers are there. So what is this? Is this homogeneous? Not at all. So that's why we are discussing that why hyaline cartilage they have mentioned homogeneous. Okay, so you can understand it now, right? So this is hyaline cartilage and we have done what is the importance of it, where is it located, and how do we appreciate it, है ना. So it is amorphous, glassy appearance. It is made up of abundant type 2 collagen. We'll talk about this. See, there are three cartilage types, right? One is hyaline, another is elastic, one is fibrocartilage. The name itself says, I have discussed it in previous class, fibrocartilage, fibrous, bone, right? From bone we can understand fibrous, similar nature, and that's how we will know that in fibrocartilage there will be abundant which kind of collagen? Type 1 collagen, 1 bone, B-O-N-E, right? So B1. So that's how we remembered it, right? So okay, अभी के लिए आगे बढ़ते हैं, then we'll go ahead. Okay, so yes, now let's see about elastic cartilage, what literature has to say. See, elastic cartilage is your most flexible cartilage, hence the name elastic cartilage. It supports parts of your body that need to bend, obviously, and move to function. Now, elastic cartilage can bounce back to its original shape. है ना, अपने ईयर को मोड़ के देखो और देखो कि वापस वो अपने ओरिजिनल शेप में आता है कि नहीं आता है. सो अंडरस्टूड पिन्ना, है ना. सो इलास्टिक कार्टिलेज कैन बाउंस बैक टू इट्स ओरिजिनल शेप even after a strong force. Your ear is made of elastic cartilage. It can bend and move without hurting. Obviously it will not hurt, nerve supply तो होता नहीं है, it is insensitive, so it will not hurt, and before returning to its usual shape. तो ये है आपका elastic cartilage. How will you identify? See, I will write it down also. Let's write it down. Identify. So how will you identify? You will like it, write this, that elastic cartilage have extensive dark purple elastic fibers. Obviously you can see that, appreciate that in the slide also. Okay, elastic fibers networks is there, and where it can be found, this is very important point, and this itself is enough to give you a clincher. But anyways, it's enough to be a clincher. Another examples are your ear pinna, epiglottis, very important, your eustachian tube or auditory tube, right? Those all are having elastic cartilage. Okay, and we'll see that in the 3D model as well, so you need to wait till the end of the class when we will revise all the examples, okay, in the 3D model. So you understood this, right? And very important point, another clincher I should say, here only I will write it down. Elastic cartilage is more cellular than hyaline cartilage. Very important. That means already you are seeing it, right? If you see again, है ना, तो ये बड़ी पिक्चर है, बड़ी पिक्चर है इसलिए ज़्यादा दिख रहा है ऐसे नहीं, पर अगर इसको और जूम करें तो वी विल अंडरस्टैंड कि yes, there is this homogeneity in hyaline cartilage, there are chondrocytes, but if you look at the closer picture of elastic cartilage, you see there are much more number of chondrocytes. Okay, you can see that it is, okay, it looks like more cellular, and then there you are seeing this dark purplish, okay, elastic fibers in the slide. So this is how you will distinguish elastic cartilage from hyaline cartilage. Fibrocartilage is very easy actually, nobody confuses this fibrocartilage with another two kinds because it is very evident. But elastic cartilage, hyaline cartilage आपको समझ में आ गया आपकी कैसे करना है. ग्लासी अपीयरेंस उधर है, यहाँ पे elastic cartilage की आपकी dark purplish this thing है, chondrocytes आपको दिख रहे हैं, more in number you can see. So this is elastic cartilage. Okay, so let's come to fibrocartilage before we move on to the slides and finally to the chart, है ना. ज़्यादा इसको लंबा खींचने की ज़रूरत नहीं है, जो most important है from basics to advanced we are going. Okay, so let's see. Fibrocartilage. Fibrocartilage is what its name sounds like. Tough cartilage है, made of thick fibers. It is the strongest and it is the least flexible of the three type. Most flexible क्या था? Elastic cartilage, है ना. Abundant type 2 collagen किसमें था? Hyaline cartilage में भी abundant type 2 collagen था. Okay, it was in the joints में वो help कर रहा था. It is tough enough to hold parts of your body in place and absorbs impact. So it is the strongest and least flexible. Here only you should understand कि इसमें कौन सा collagen ज़्यादा होगा, है ना. और आई शुड राइट इट, यहाँ पे ही हम स्टार्ट करते हैं. हाउ टू आइडेंटिफाई. ओके, हाउ टू आइडेंटिफाई. सो abundant type 1 collagen and an acidophilic matrix is there. Some of them is bookish language, तो इसको मैं ऐसे ही बोलता हूँ कि bookish language. आपको याद होना चाहिए कि बुक में क्या लिखा है, लिटरेचर में क्या लिखा है, ताकि ऐसे कोई क्वेश्चन बने यूनिवर्सिटी के एग्जाम में तो आप गलत ना करें. ओके, और इफ़ यू हैव टू राइट द डेफिनेशन ऑफ इट, इफ दे आस्क यू हाउ टू आइडेंटिफाई, यू कैन राइट इट डाउन. ओके, सो बट मोस्ट इंपॉर्टेंट इज इट इज हैविंग abundant type 1 collagen. That's why it is least flexible and it is very supportive. Okay, another thing is, where is it found? Found in the IVD, intervertebral disc. Okay, it is also found in pubic symphysis. Very important, guys. They have recently in one of the exams, or I think it was a GT, where they have given this picture of our hip bone, pelvic girdle, and they have given they have marked a picture indicating it is pubic symphysis, and they asked what kind of cartilage is present here. So you should know कि in pubic symphysis and between your intervertebral between your vertebrae where intervertebral disc is there, that is nothing but your fibrocartilage, because see it needs support, right? That is where support is needed. So fibrocartilage is there. Okay, understood? समझ में आ गया? Now how do you see it? Very easy to identify. क्या दिख रहा है आपको स्लाइड में? Just look at the slide and try to appreciate the features. You are seeing something like parallel fibers are running. Can you see? These are parallel in nature, right? Parallel rows are there. This is what they write in literature also. If you see parallel rows of cells or chondrocytes in a slide, that is most likely to be fibrocartilage. So let's write it down. We'll see we'll write it down further ahead going into the chart also. So but for now, try to understand it. Or let me show you the pictures only. Directly I will show you the picture. Okay, यहाँ पे पहले लिख भी देते हैं अपन. How do you identify में लिखना ज़रूरी, right? So here there is dense regular connective tissue and chondrocytes are arranged in parallel rows. You will appreciate this feature more in the upcoming picture. So let's see. देखो कितना प्यारा picture है ये, and now you can try to understand. So you are seeing this parallel rows. See, ये parallel rows हैं आपके chondrocyte के. They are parallel to each other and they are rows of chondrocytes. So if you are seeing rows of chondrocytes, parallel arrangement is there. That is your fibrocartilage. How easy to identify? See, now look at these three pictures and you only tell me which one of these three looks very homogeneous, very smooth, very glassy. आप देखो fibrocartilage, still fibrils are there, है ना? तो आप you can see कि यार नहीं, this doesn't look homogeneous. Elastic cartilage, not at all. Look at this, how much this meshwork is there. But look at hyaline cartilage, how much smooth appearance it is having, how much glassy appearance it is having. So this is what I was telling you. Okay, so this is how you can identify. Now look at hyaline cartilage and look at elastic cartilage. How beautifully what we have studied, we can apply it here. You can already see that elastic cartilage looks little bit more cellular, है ना? More chondrocytes are there, more fibril, this more meshwork is there, dark purplish fibers are there, which are elastic fibers, है ना? That's why the elasticity, that's why it bounced back to its original shape also. So that's why this is elastic cartilage, है ना? This is elastic cartilage, this is your hyaline cartilage, this is rows, parallel rows of chondrocyte is your fibrocartilage, है ना? तो अब आप समझ गए. अगर आपसे कोई बोले कौन सा कार्टिलेज है जो ग्लासी अपीयरेंस दे रहा है, आप बोल देंगे हाइलिन. विच कार्टिलेज इज हैविंग डेंस फाइबर्स, डेंस पर्पलिश फाइबर्स, मोर सेलुलर इन नेचर देन हाइलिन कार्टिलेज, इलास्टिक फाइबर. विच वन इज हैविंग पैरेलल रोज ऑफ कॉन्ड्रोसाइट्स, दैट इज फाइब्रोकार्टिलेज. abundant type 1 collagen is fibrocartilage. So this is how you can easily answer those questions. Okay, this is what they have given also. That's it, है ना? तो अब ध्यान से अगर why I've brought this slide is you can now look at these pictures also. Okay, again see, that was illustration, this is original picture. You see this homogeneous, है ना, matrix, this is hyaline cartilage. You see this rows, parallel rows of chondrocyte, this is your fibrocartilage. And you see dark purplish, dark bluish this material, and there are lot of this chondrocytes, there are lot of cells, and a lot of cells are there, dark purplish matrix is there. This is your elastic cartilage. I hope you are able to appreciate the difference between all the three slides, है ना? We are still not done. Let's see another pictures, another kind of pictures that they show you. Now I'll give you 2 seconds, okay? आप मुझे बताओ which one is what. If I ask you what is A, what is B, what is C, you should answer this wherever you are sitting and watching this video. Answer this. कौन सा आपको कौन सा लग रहा है ना? Answer this and then maybe थोड़ा चाय पी लो यार. हाँ जी, अभी तक तो आंसर आ जाना चाहिए. रेडी? लेट्स सी द आंसर्स. ओके, सो सेम पिक्चर है ना, थोड़ा सा डिटेल में. सो दिस है ना, इफ यू सी स्लाइड्स डू चेंज है ना, मटेरियल डू चेंज. तो ऐसे एकदम कलर पे अपन को चिपक नहीं जाना है. बट लुक एट दिस dense meshwork, dense fibers, lot of cells, dense meshwork is there. There are no parallel cells or chondrocytes rows are seen here. So this naturally becomes elastic. Okay, so this is elastic fiber. You see, yes, chondrocytes are there, but very homogeneous matrix is there all around. So this is your hyaline cartilage. And when you see these rows, है ना, ये तो आप भूल ही नहीं सकते. आई ऑलरेडी टोल्ड यू कि फाइब्रो कार्टिलेज में कोई कंफ्यूजन करता ही नहीं है. सो दिस इज हाउ, इफ यू सी रोज ऑफ दिस कॉन्ड्रोसाइट्स, पैरेलल रोज, दिस इज फाइब्रो कार्टिलेज. सो कैन यू नाउ अप्रिशिएट कि दे कैन, है ना, डोंट जस्ट स्टिक टू अ कलर कि अरे सर पर्पलिश नहीं है, रेडिश नहीं है. अरे डोंट वरी अबाउट दोस थिंग. लुक एट द कोर पिक्चर. व्हाट यू आर सीइंग, इज इट होमोजेनस, इज इट dense fibrils are there, more cellular it is looking, is it rows of chondrocytes you are seeing. So this is how you can differentiate between these three. I think there is no problem in this. Okay, now you can understand all these three are important. So basically the same picture. ठीक है, अब आगे बढ़े. Let's look at another picture, है ना, they have explained it also. So just look at this. Let's look at hyaline cartilage, chondrocytes and lacunae, that is fine. Matrix is homogeneous, see, very glassy. Then look at the fibrocartilage, it still have fibers, है ना, still have fibers. So chondrocytes, collagen, this matrix fiber is there. But if you look at, if you are having any confusion between fibrocartilage and elastic cartilage, this will clear your confusion. If you see, try to differentiate chondrocyte. So many chondrocytes. Is it more cellular? Definitely it is more cellular. Is it more dense? So much dense color is there. Yes, it is more dense because there are lot of dense elastic fibers are there. So that's why this is elastic. So use your common sense, guys. I have shown you different pictures because see, this is how they can confuse you. अगर आप एक ही कोई particular slide देख के जाएंगे, एक ही कोई particular picture देख के जाएंगे, it will not help you. Okay, so we have seen various varieties of pictures, but at the core of it is same thing. Rows देखो, homogeneity देखो, glassy appearance देखो, cellularity देखो. It will clear your doubts and it will help you to answer the question. Okay, so understood, समझ में आ गया. Let's go ahead. Now everything we talked about cartilage, but cartilage have what extra thing we should understand, right? So let's look at this picture. This is your hyaline cartilage. Hyaline cartilage कहाँ है sir? ये रहा hyaline cartilage. You can now appreciate this homogeneous matrix and this chondrocyte. So yes, this is hyaline cartilage. What is this, sir? Outside of hyaline cartilage, what is this? This is definitely the cover of the cartilage. What is that? That is perichondrium. We already talked about perichondrium, right? Perichondrium forms periosteum also in bones, right? So here this is perichondrium. Perichondrium is also outside fibrous in nature, inside cellular in nature, that is same. But this is perichondrium. So here only I am trying to ask you another question. Which cartilage lacks perichondrium? You have to answer it right now. We will do it, okay? So अगर किसी को आता है तो मन में आंसर कर दो भाई. Kudos to you. So okay, so see, if you look at this picture also, you know, perichondrium is there. Okay, so perichondrium can be there in covering. So this is fine. You already must be knowing this. Anyways, collagen, perichondrium is what composition wise it is what collagen fibers are there, spindle shaped cells are there. So I already told you कि fibers are there, it is fibrous in nature, outside is fibrous in nature, inside cells are also there, and these cells have the capacity to transform into chondroblast and form new cartilage. So this is so important. Why do we leave these things? है ना, cartilage पढ़ लेते हैं. अगर आपसे कोई पूछ ले, कोई बच्चा आके पूछ ले कि सर कार्टिलेज बनता कैसे है सर, कहाँ से आ रहा है ये, तो व्हाट यू विल से, बस ऐसे ही, है ना. तो भगवान की देन नहीं है, एवरीथिंग इज भगवान की देन. बट अंडरस्टैंड इट हियर कि पेरिकॉन्ड्रियम outer layer is fibrous, inner layer is cellular. Why inner layer is cellular? Because that layer है ना contains those cells. Which cells? Chondroblast. And what do they do? For example, progenitor cells हमारे पेरियोस्टियम में कहाँ थे? Connected, integrated. पेरियोस्टियम पेरिकॉन्ड्रियम है ना, एक ही फैमिली से बिलोंग करते, वी कैन अंडरस्टैंड इट लाइक दिस. पेरिकॉन्ड्रियम में भी, पेरियोस्टियम में भी आउटसाइड फाइब्रस लेयर था. इनसाइड लेयर ऑफ पेरियोस्टियम वाज हैविंग प्रोजेनेटर सेल्स. दोस प्रोजेनेटर सेल्स वर फॉर्मिंग व्हाट? Osteoblast. Same here. Your perichondrium second layer is having same cellular layer. It is having what? Now here it is cartilage. So chondroblast, and it will form new cartilage. So I hope it is coming back to you है ना, all that information. It will, everything will come back to you by the end of this course है ना. सब कुछ integrate हो जाएगा. Anatomy is like a cycle. जब आप शुरू से पढ़ते तो लगता है क्या क्या पढ़ रहे हैं, but at the end everything comes back to you. Okay, so this is what perichondrium is है ना. So understood the importance of perichondrium. It is not only just the covering, it nourishes the cartilage. It is having chondroblast which is forming the cartilage. So this is very important. Not only it protects, it nourishes, and it forms also the cartilage. Okay, so this is what I showed you. If they mark this point है ना, let's say कि आपको this slide they have given you and they have not marked this, they have marked this. What is this? This is perichondrium. Okay, this is perichondrium. Understood? चलो आगे बढ़े. Can you now appreciate? है ना, नीचे जो आप देख रहे हैं, this is cartilage. But here, what you are seeing, this is perichondrium, outer fibrous, inner cellular. Cellular भी अब now you know. Cellular also contains chondroblast, forms new cartilage. ठीक है, good to go with cartilage. Everybody fine है ना. Let's see another beautiful picture. See, this part is your cartilage and this part is your perichondrium है ना. Perichondrium. Now yes, that's why I brought this picture. Very important point. Perichondrium is absent where? I'm still I have to answer that question, right? I hope you guys must have answered that question. Otherwise by the end of this class you will answer. But the very important point कि this perichondrium, see, it is absent in one kind of cartilage, but it is present in hyaline cartilage. It is present in hyaline cartilage. It चलो भी बता ही देता हूँ यार. Okay, why to keep so much of suspense sir? इतना ऐसा छोटा सा तो क्वेश्चन, तो बता दो आंसर. So let's see. See, perichondrium is absent in fibrocartilage. This is your answer. Perichondrium is absent in fibrocartilage. Perichondrium is present in hyaline cartilage and elastic cartilage. But exception becomes question. What is the exception here, sir? यहाँ तो हमको कोई exception दिख ही नहीं रहा है. There is an exception. See, hyaline cartilage have perichondrium except where? Hyaline cartilage at the joint surface. That means, sir, joint surface, are you talking about articular cartilage? Of course. The articular cartilage which is nothing but your hyaline cartilage is not having perichondrium. Perichondrium is absent there also. This is such an important question. Perichondrium is absent. Fine. So हमने क्या पढ़ा? पेरिकॉन्ड्रियम के मैंने बोला ना बेसिक से एडवांस, तो हमने बेसिक पढ़ लिया. व्हाट इज पेरिकॉन्ड्रियम, व्हाट डज इट डू. बट हमको अब समझ में आना चाहिए कि क्वेश्चन क्या बन रहे हैं. पेरिकॉन्ड्रियम इज एब्सेंट इन फाइब्रोकार्टिलेज. एवरीबडी नोज इट. अगर पढ़ा है तो इतना तो आता है. बट वन मोर थिंग, गो स्टेप अहेड. Hyaline cartilage and elastic cartilage have perichondrium, but hyaline cartilage at the joint surface where it is actually becoming the articular cartilage, nothing but hyaline cartilage, does not have perichondrium. Okay, so please see here, perichondrium is there in hyaline cartilage, but excepts are what? Exceptions are around the, let me use another color, around the articular cartilage and fibrocartilage. So fibrocartilage nobody forgets. Articular cartilage भी लोग याद रख लेते कि या आर्टिकुलर कार्टिलेज डज नॉट हैव पेरिकॉन्ड्रियम, बट व्हेन दे आस्क हाइलिन कार्टिलेज देन यू गेट कंफ्यूज. यस, ऑफ कोर्स हाइलिन कार्टिलेज हैव पेरिकॉन्ड्रियम, बट देयर इज अ एक्सेप्शन आर्टिकुलर कार्टिलेज है ना. तो ये आपको कनेक्शन याद रखना पड़ेगा. ओके, Anyways, so blood vessels are here. It helps in growth and repair. It provides gas and nutrients to cartilage cells. So I told you perichondrium not only helps in nourishment, not only helps in protection, it helps in repair also. It helps in formation of new cartilage also. This is all is very important. Okay. So this is where we are done with the basics of everything. Let's summarize it. Shall we summarize it, or shall we look at another picture? No? So let's summarize it. I have made it in my notes also. Just give me a second. मैंने क्या कहता जब हमने कार्टिलेज पढ़ा था, तो दिस वाज वन सच टॉपिक जो मुझे लग रहा था यार इतना बोरिंग है ये, इसको कैसे याद करूँगा. तो मैंने पहले पूरा समझने की कोशिश की. देन आई अंडरस्टूड कि यस देयर आर सर्टेन लॉजिक है ना, लॉजिक के हिसाब से चलेंगे तो ये हो सकता है. फिर मैंने सोचा व्हाई नॉट मेक अ टेबल आउट ऑफ इट, एंड सो दैट एट द एंड ऑफ द this whole of my preparation, जब एग्ज़ाम का टाइम आएगा, आई विल जस्ट लुक एट दिस टेबल. आई नो द कॉन्सेप्ट नाउ. I don't need to do anything. Within 5 minutes cartilage will be done. Okay, so let's go ahead. Now you already know. थोड़ा सा अपने fill in the blanks करना है अपने को. Okay, so let's see the picture. Okay, so when we talk about hyaline cartilage, and we'll see what literature also has to say, so we'll fill accordingly. When we talk about hyaline cartilage color, if they ask you, you have to write bluish opalescent. Okay, so bluish in nature is your hyaline cartilage. Okay, understood. When they talk about elastic cartilage, obviously this is that yellow cartilage. Elastic cartilage is yellow cartilage. Okay, able to answer those questions? Then when they ask about fibrocartilage, this fibrocartilage is white in color. Easy to remember actually. Elastic cartilage, yellow cartilage, fine. Actually everybody knows it. Bluish cartilage, hyaline cartilage, you must know this. Fibrocartilage, bone is white. Type 1 collagen, white in color. So fibrocartilage, white in color. Then when we talk about collagen, so yes, predominantly type 2, obviously type 1, predominantly type 1, and this is the main type. Please remember, type 1 is, I should write it like this is main. But does that mean it only contains type 1? No, it also contains type 2. So type 2 is also there, but fibrocartilage, so fibrous means type 1 is the main abundant one. So that is this. About perichondrium is present except where? Except at articular cartilage. And articular cartilage basically किस एरिया में आता है बोन के? So this is how you can remember it. Articular cartilage and epiphysis. Okay, so it's fine, no need to remember other thing. Articular cartilage में it is absent, but even though it is a hyaline cartilage only, but the perichondrium is absent. Otherwise overall in hyaline cartilage the perichondrium is present. Okay, the exception is articular cartilage. In elastic cartilage it is definitely present. In fibrocartilage it is definitely absent. Done है ना? आगे बढ़ते हैं. So when we talk about calcification occurs, but occurs with old age, है ना? So wear and tear के बाद old age. In elastic cartilage, so important, है ना? No calcification. ऐसा कभी होगा क्या that your ear pinna becomes fully calcified? Does this happen in everyday terms? In your grandparents' ears, if you see elder people ears, if you see, does they become calcified? Not at all. They are still mobile and very flexible. So no calcification in elastic cartilage. In fibrocartilage, very important point, guys. Please don't forget. Occurs only with bone repair. So if bone is getting repaired in that cartilage, then it may happen, then this ossification that can occur. Okay, so this is not this calcification can occur, not ossification. Okay, so calcification can occur. Then cells. What kind of cells? So yes, chondrocytes and chondroblast. Here definitely same, chondrocytes and chondroblast. Here obviously fibroblast. So this is what you have to remember. And rows, parallel rows of what? Chondrocytes. Done? Good to go? आगे बढ़े. What about fibers? What about fibers? So what about fibers? They are in hyaline. They are thin collagen. That's why it gives you a glassy appearance. Thin collagen. In elastic fibers, they are dense. Elastic fibers, dense. And your fibrocartilage, it is very thick. Well, it is thick because it is fibrous, you know, fibrous cartilage. It has to provide the strength. That's why it is thick cartilage, elastic cartilage. Anyways, examples now. This is the most important point. We are coming to the end of the this chapter. Examples are very important. You now know the concept. Trust me, you know everything about cartilage. You know how to identify the cartilage. You know the basics around it. Perichondrium, what does it do? Where is it absent? You know, every exception you already know. Now your most important task is to remember the examples of each and every cartilage. Now, how do I remember it? Does mnemonic help? Not at all. mnemonic को जहाँ तक हो सके avoid करा करो, because mnemonic याद रह जाता है, उनके examples याद नहीं रहते हैं. What we'll do is we'll theory wise we'll first sensitize ourselves to those examples, then we'll look into the 3D model. We'll try to see कि वो कहाँ पे, when it comes into our visual memory, we will remember it for a longer time. And I will tell you also where to focus upon, है ना, कहाँ पे ज़्यादा important है, that I will tell you, which I am coming back to that knee joint, you remember? Okay, चलो, so examples कर लेते हैं पहले. Then when I'll do the 3D model, you yourself will say, okay, कि कहाँ कहाँ क्या क्या है. So let's see. In hyaline cartilage, the examples are, if we talk about the laryngeal cartilage, we'll see cricoid cartilage is hyaline, thyroid cartilage is hyaline, arytenoids is hyaline, except arytenoids का except एपाइसिस, है ना, एपाइकल जो एरिया है, जस्ट द टॉप पॉइंट ऑफ एरेटिनोइड्स जो है, मैं एरेटिनोइड्स तो दिखाऊंगा, उसके टॉप पॉइंट जो है that is not hyaline. Okay, so arytenoids except the apical area is your hyaline. So arytenoids overall अगर आपसे कोई पूछे, yes hyaline, but except the apices. So this you should know. So cricoid cartilage, thyroid cartilage, don't worry if you don't know, sir, what is this cricoid cartilage, where is it located? We are about to see the 3D picture. Nobody will be able to tell after this class कि sir where is it located. Okay, so arytenoid cartilage, for now just look at the examples. Okay, so arytenoid cartilage, I'll bring another picture. Then epiphyseal, I already talked about it. Epiphyseal plate or your growth plate. I hope you remember it from our previous class. I will not explain to you it. I will not explain to you this thing again. You have to look at those videos and then come back to it. Okay, क्योंकि फिर मतलब नहीं, अगर आप पहले नहीं पढ़ रहे तो बेसिक से चलो. ठीक है, एपिफाइसियल प्लेट मैंने इसका पूरा लिंक भी समझाया था. और ग्रोथ प्लेट कंटेन्स, दिस इज नथिंग बट योर हाइलीन कार्टिलेज. ओके, एंड देन योर कोस्टल कार्टिलेज. कहाँ होता है कोस्टल कार्टिलेज? रिब्स में, राइट? That is your hyaline cartilage. Okay, and definitely how can we forget articular cartilage? Articular cartilage at the end of bones, ना, bone के end में जो है that is nothing but hyaline cartilage. So can you now understand? Don't worry about cricoid, thyroid, abhi yaad ho jayega, but these are laryngeal cartilage. So cricoid cartilage, thyroid cartilage, arytenoid cartilage, except the apices, growth plate, very important, growth plate is having hyaline cartilage, and your articular cartilage is also having hyaline cartilage. Understood? सबको समझ में आ गया है ना? Especially if you they mention it also, but not that important. Shall I write it? I'll write it. If you talk about a very important or not so important point, one example you should write it like this: there is temporary skeleton, if the, or I'll write it in a better way. Okay, यहाँ पे बना देता हूँ मैं. टेम्पररी रहता है for some time only, skeleton of embryo. Okay, so temporary skeleton in embryo, this can also have hyaline cartilage. Not that important, nobody asked this, it is given in the literature, you can understand it, but otherwise they are going to ask you what I have written it in the box only. Okay, regarding elastic cartilage, very important, that apices, sir आपने बोला arytenoids is hyaline cartilage except the apices. So apices are what? Apices are elastic cartilage. So apices or apical end of your arytenoid, okay, very important, epiglottis, है ना, leaf shaped thing. Then what other cartilage? Corniculate. Okay, so these are all laryngeal cartilage now. So corniculate cartilage comes under elastic cartilage. This is very important. Okay, cuneiform also, just remember this, cuneiform cartilage comes under this elastic cartilage. Very important, eustachian tube, already I talked about it. Eustachian tube or auditory tube is under elastic cartilage. Obviously pinna, ear pinna is elastic cartilage, and external auditory meatus, okay, external auditory meatus is your nothing but elastic cartilage. Okay, external auditory meatus में जो cartilage है, that is nothing but elastic cartilage. So this is so important, right? So what we have studied so far, arytenoid जो है hyaline है, पर apices जो है elastic है. Then you understand that bigger cartilage, I will show you. The cricoid cartilage is a big cartilage. Thyroid cartilage is very big cartilage. So those bigger cartilage, hyaline cartilage. Smaller cartilage like corniculate cartilage, like cuneiform cartilage, these apices of the arytenoid, so small. Arytenoids itself is very small. I will show you just now. But apices of arytenoids very small. So elastic cartilage. So this is how you can remember it, right? So bigger cartilage that so far we have learned about the larynx one are hyaline cartilage, but smaller cartilage, cuneiform cartilage, this your corniculate cartilage, apices of arytenoids, these are your elastic cartilage when it comes to larynx. So far we have remembered it, but epiglottis is your elastic cartilage, pinna is elastic cartilage, eustachian tube is your elastic cartilage, and external auditory meatus is your elastic cartilage. Fibrocartilage, very easy. Okay, fibrocartilage is very easy, but very important examples you should know is your intervertebral disc. Very important, right? This we already talked about. Intervertebral disc. I should write it like this. Meniscus. This is what I was talking about, guys. Listen to me now. I'll show you the picture also. Or I have a picture. This is very important. Just look at this, okay? When you see the end of the bone which is forming articulation with another bone, this is the articular cartilage. So the blue color that you are seeing here is nothing but your articular cartilage, you know. So articular cartilage is which cartilage, guys? This is hyaline cartilage. But what you are seeing in purple, guys, This is your knee joint, obviously you are seeing this, है ना, tibia fibula you are seeing. This is your meniscus, है ना, lateral meniscus, medial meniscus. Okay, this is meniscus. So when it comes to, why I am showing you this, when it comes to joint, if you only remember one thing कि हाँ joint की surface there is a hyaline cartilage, you will forget this thing कि joint की surface पे there is also one thing in knee joint, menisci. And this menisci is nothing but, what are they? They are fibrocartilage, guys. They are fibrocartilage. So important. Menisci are fibrocartilage, but your this articular cartilage is definitely your hyaline cartilage. So can you now see that within a joint capsule, knee joint capsule, you are having both the cartilage. You are having hyaline cartilage also, you are having fibrocartilage also. Good to go, है ना? तो ये आपको समझ में आ गया. 3D मॉडल में आपको देखना है और आप समझ जाना है कि आर्टिकुलर कार्टिलेज इज हाइलिन कार्टिलेज बट मेनिस्का इज योर फाइब्रोकार्टिलेज. ओके, अंडरस्टूड. चलो आगे बढ़ते हैं. सो मेनिस्का है, इंटरवर्टिब्रल डिस्क, दिस आर फाइब्रोकार्टिलेज. वेरी इंपॉर्टेंट व्हाट दे आस्क्ड, pubic symphysis. Pubic symphysis is your this fibrocartilage. Manubrosternum joint. Okay, manubrosternal joint is your fibrocartilage, है ना. And very important, I'll write it in a special color. There are linings or grooves on the bone. Okay, various bone we'll see. I'll show you in the 3D model also. In humerus bone, for the biceps brachii tendon, there is a groove on the humerus bone because the tendon, for the tendon there is a space, है ना, there is a space in the bone जहाँ पे वो आराम से sit करता है. This is a groove for the tendon. This groove contains what? Okay, this grooves for tendons of the muscle contains what? Fibrocartilage. Fibrocartilage. Understood? समझ में आ गया, है ना? We are just going to go directly to the 3D this thing, but you now understand bigger cartilage of the larynx, cricoid cartilage, thyroid cartilage, है ना? These are all arytenoid cartilage. Except the apices are hyaline cartilage, epiphyseal plate nobody forgets, articular cartilage nobody forgets, elastic cartilage, smaller cartilage of the larynx, cuneiform, corniculate cartilage, these are apices of the arytenoid, these are epiglottis, this is your elastic cartilage, so this is elastic cartilage, pinna, external auditory meatus, fibrocartilage, big important points, menisci in the knee joint, intervertebral disc is your fibrocartilage, and then you see pubic symphysis, manubrosternal joint, and also the linings or grooves on the bone. Okay, so we are going to see that. For now, just look at this picture. This is what they have given. They marked it as X. Obviously, they didn't show that it is pubic symphysis. You only have to see. So, what cartilage is there here? Fibro cartilage. So if they ask this picture, okay, so if they show you this kind of picture or intervertebral disc, or just now I'm going to, that's why I'm going to show you 3D. 3D में सब समझ में आ जाएगा. If you see the 3D and if they ask the same picture, good to go. ठीक है? So this is fibrocartilage. Now see this laryngeal cartilage. So if you see this bigger cartilage, okay, this bigger cartilage is your thyroid cartilage. Fine. Then bigger only but smaller than thyroid cartilage, this complete C-shaped ring, this is what? Cricoid cartilage, cricoid thyroid cartilage. ये क्या है भाई? Answer है ना? So they are hyaline cartilage. Then what you are seeing here, guys, focus upon here. What you are seeing here, this one is your arytenoid cartilage. Arytenoid cartilage का जो apex है ना, जो apex है, apical जो portion है, that is your elastic cartilage. Otherwise arytenoid cartilage is your hyaline cartilage, है ना. Then what you are seeing here, arytenoid के ऊपर कौन बैठता है ना? I will show you in the 3D. arytenoid के ऊपर बैठता है, okay. So that is corniculate cartilage. So if they show you arytenoid and they mark the apical picture, that is fine, elastic. But if they show you full arytenoid bone, above that different bone is there, then you have to see that is elastic cartilage, that is your corniculate cartilage. Cuneiform is another, this bone, है ना, this bone is this is sorry, not bone. If you see another cartilage, है ना, I misspoke that as bone, but you understood, right? So if you see another cartilage, so that is corniculate, and then if you see this one, that is cuneiform, है ना, you are just now seeing that. So cuneiform भी आपने देख लिया ध्यान से. So these are elastic cartilage, these are elastic cartilage. Then what you now see other than this, okay, Nothing else you are seeing, right? Yeah, you are seeing this one big thing, leaf like thing. What is this? This is epiglottis. Again, this is elastic cartilage. So see, this is such an important picture. They may ask you anything. They may just mark it like this and they will ask you what is this cartilage, what is this cartilage, what is this cartilage. So bigger cartilage अगर एक दिमाग में है कि हाँ यार वो hyaline था, smaller cartilage are your this thing elastic. So this is how you can good to go with it, and then with practice it will come. Okay, understood. Now we will look into the 3D picture. ठीक है? Okay guys, so now we'll talk about 3D picture. Now in 3D picture I may not be able to annotate it. Okay, it is not I cannot annotate it, so you can just now see. Tell me what is this, है ना? ब्लू कलर में ये क्या दिख रही है आपको? Just show. सर थोड़ा जूम करेंगे. या दिस ब्लू इन कलर. यू आर सीइंग रिब्स, बट रिब्स के साथ क्या है? कोस्टल कार्टिलेज. कोस्टल कार्टिलेज कौन से कार्टिलेज होते हैं बताओ जल्दी से. अब आपको आंसर देना है यार, है ना? सो कोस्टल कार्टिलेज आर विच काइंड ऑफ कार्टिलेज? कोस्टल कार्टिलेज आर hyaline cartilage. So this what you are seeing here is coastal cartilage. Understood? So this is our coastal cartilage. What is this guys? Tell me. This is manubrium. This is your manubrium, right? And this is your sternum. Manubriosternal joint. Manubriosternal joint. Manubriosternal joint. What is this joint? Which cartilage guys? Manubriosternal joint, you already know. This is your fibrocartilage, right? So this is manubriosternal joint. Okay, understood. So costal cartilage ho gaya. This manubriosternal joint is fibrocartilage. This we already saw. Now you just see here guys. See here. Are you able to understand कि this is your humerus bone, है ना? मैंने सिर्फ वो निकाल के लाया हूँ जो आपको समझना है अभी, है ना? Not the complete picture. So this is humerus bone, arm. This is humerus bone, right? This is your front picture, है ना? आप देख पा रहे हैं? This is your front picture. आप front से देख रहे हैं, ठीक है? So humerus bone, which is this muscle? Biceps brachii, right? This is biceps brachii, है ना? So biceps brachii का this is long head. Now can you see this biceps brachii is going. Biceps brachii is going through a groove, है ना? There is a groove on this bone, right? For that where this tendon is sitting and it is going ahead. So what is this groove lined with? I will show you the groove also. So अब आपको picture आ गया कि this biceps brachii is lying on that groove. Let us see without biceps brachii how does this bone look, है ना? So it is. I hope you are able to see this groove, है ना? This groove you are able to see at the top. At the very top you are able to see the groove. So that groove in the bone for the tendon is lined by what guys? That groove in the bone is lined by fibrocartilage. Okay, so groove for tendon. So this is how I showed you this one. Okay, तो ये एक example हो गया. Manubriosternal हो गया. This costal cartilage हो गया. Okay, so this is that cartilage. Now let us see what is this cartilage guys. What is this cartilage? Intervertebral disc. This is your intervertebral disc. This intervertebral disc is your which cartilage? It is your fibrocartilage, right? So this is your fibrocartilage. Again, can we focus upon here? Between pubic bone, है ना? Between pubic symphysis, it is not there, it is not given, but between pubic symphysis, this bone will be what? Your again fibrocartilage. Okay, so there will be fibrocartilage. Then what shall I show you? Yes, let us see here. Focus upon here. Now please pay attention. If you have already done my class, you now know if I mark it here, you know, the bone you are seeing, because I cannot mark the very end of it, but the very end of it, the shiny thing that you are, the smooth thing at the end of the smooth surface that you are seeing at the end of this bone, what is that cartilage? That is articular cartilage. I hope you are getting my point, right? So that smooth surface that you are seeing, that articulating surface that you are seeing of this bone, you know, of this bone femur, is what? That is your articular cartilage. Articular cartilage is hyaline cartilage. But if I show you this, tell me, can you now see this? What is this? If I show you this bone, the shiny surface of that is your articular cartilage, hyaline cartilage. But I am showing you what now? This is what guys? This is your menisci, and menisci is what cartilage? That is your fibrocartilage. This is what I wanted you to focus upon, that if they mention here and they mark it as X, then you have to mark fibrocartilage. If they mark that articulating smooth surface of this bone or any bone joint surface articular cartilage, that is your hyaline cartilage. Menisci is this is fibrous cartilage. Understood? समझ में आ गया इतना? I hope इतना समझ में आ गया है ना? Let's see. If they ask you another, what we have done. Yeah, see, if they ask you this also, guys, you know, one more example, I'll write it in the chart also, but you can only add it. If they ask you this, see, this is femur bone, this is joining where? This is joining the acetabulum, right? You know, this is joining your this thing. So this thing, what is this, guys? This is known as, what is this? This is known as acetabular labrum. What is this? This is known as acetabular labrum. Acetabular labrum is also like intervertebral disc, is also like menisci, it is also fibrous cartilage. So this one example we missed in that table, right? So here you have to write it, add it into your table. This acetabular labrum, in fact glenoid also, that is also your fibrous cartilage. So this is the acetabular labrum. Okay, so this is acetabular labrum. Mark this as fibrocartilage. Mark this as fibrocartilage. I hope you are getting my point, Hana. I hope you are enjoying my classes. Okay, let me know in the comments, or you can approach me on Instagram as well. Okay, so this is done, Hana. This cartilages are done. Let me show you the main thing. चलो आ जाते हैं इस पे. Okay, if I tell you, okay, if I tell you this, can you see? I hope you are able to see. The spinna is fine. The spinna is fine. That is your elastic cartilage. You know, if I tell you external auditory meatus, if I mark external auditory meatus, can you see external auditory meatus going to the bone? If I mark that, which is that cartilage? External auditory meatus is also elastic cartilage. So this, if they mark external auditory meatus, that is elastic cartilage. If I mark this, what is this, guys? Can you now see? What is this? What is this? है ना, इसके अंदर का पहले देखते हैं. What is this on the other side? On the left side, if you see, what is this in blue color? This is your eustachian tube. This is your eustachian tube. This is how it follows the path, है ना? So this is eustachian tube. But what is this covering here? You can see here it is red in color. Here it is white in color. That white color covering, you know, not just, don't just go with cover. I'm just trying to explain that there is a cover. What you are seeing here is cartilage. This is cartilage. So eustachian tube cartilage, ये क्या है? Again, eustachian tube cartilage is your elastic cartilage. Okay, so again eustachian tube cartilage is your elastic cartilage. Not इसको एकदम ऐसे color wise नहीं जाना. अरे sir white आपने बोला था, that is another thing, that is histological picture. Here you are seeing a cartilage, right? That is your elastic cartilage on the eustachian tube. So this is eustachian tube. Understood? समझ में आ गया आपको? I hope आपको समझ में आ गया. Now final thing, the most important thing, जहाँ पे आप confuse हो सकते थे but अब नहीं होंगे. Now you will not get confused, right? What is this, guys? This is your, can you see now? This is your trachea. Can you see? Trachea के ऊपर ये क्या आ रहा है? Larynx, laryngeal cartilage. Okay, so let's see this. What is this, guys? This is epiglottis. This is epiglottis. Epiglottis is what, guys? Elastic cartilage. Epiglottis is elastic cartilage. This is what, guys? Thyroid cartilage. This is bigger one, right? I told you the biggest one, huh? This is thyroid cartilage. This is thyroid cartilage is what, guys? Hyaline cartilage. Then complete C-shaped ring. Can you now see? All this other rings are C-shaped, but this is complete ring. This is complete ring. Which is this? Here. Can you see? If I show you the behind picture also, can you see? It is complete ring, है ना? So this is what, guys, below, just below thyroid. This is what? Cricoid. Cricoid is hyaline. Look careful. Look carefully here. If we go and little bit zoom it, okay, so this one, this is what, guys? Arytenoid. They have not marked the apical portion of arytenoid because it is a single cartilage, so they have not marked the apical. But if they ask you apices of arytenoid, that is elastic. But if they mark this bone, this cartilage, then this cartilage is arytenoid, and arytenoid is hyaline cartilage. And what is this, guys? What is this? Blue in color. Let me zoom it more. This is arytenoid. This is arytenoid, right? This is arytenoid cartilage, and the arytenoid cartilage is your, except the apices, arytenoid cartilage is hyaline, apices is elastic. But what is this? This is corniculate cartilage, and I hope you have given the answer. Corniculate cartilage, sir, smaller one. Is it elastic cartilage? Yes, sir. It is elastic cartilage. Understood? I hope you have understood every single thing about the cartilages. and I hope you are happy with me the way I am teaching you all these things. Okay, trust me, have faith in me. As you go ahead, you will adjust to my teaching style, and by the end of all this series, all the videos, you will be super strong in anatomy, and you will thank me for that. And I will be looking forward to your comments and your messages. Okay, good luck. Bye bye.